We're going to go ahead and get started. It is, a little after 7. Thank you for joining us this evening. I wanted to welcome you to the Padre Foundation Back to School Information Night. My name is Mary Mailman. I'm the director of the Padre Foundation. And I wanted to say thank you for joining us because this is some good information tonight from our very special guests. I have Dr. Nikta Fergani. I have Dr. Mark Daniels, and I have Allison McDaniel, an RN CDE. They're all from Talk Hospital, and some of you may know them from your visits with your endocrinologist. I do want to let you know that you are muted, just so that we can get through this evening first, and then we will encourage for questions through the chat feature. But I also want you to really just listen and figure out what works out for your family this year. This is a year of change. And if traditional school doesn't fit it, maybe it's time that you do what is possible to, that will make your, your year go a little smoother for you. Reach out to your friends and your family and your neighbors for help. And it may be a 1 year, a 1 week, a 1 month. We don't know. We all don't know that. But you need to be prepared for the changes because at any moment they can say, oh, come back into the classroom. So that's what we want to do is help you, come to some conclusions, encourage you to get prepared for the school year. If that means a 504, communicating with your educators, whatever it is, those questions can be answered. We can help you come to some conclusions for your family. This isn't a one size fits all. It's not going to work for everyone. So please, it's an individual thing. One person may have one feeling and you may not agree. So we all have to be very patient with this. But I do encourage you to have questions. If we don't get to them this evening, go ahead and just email them over to us at info@padrefoundation.org and we'll address them. We'll reply to you. And if we don't know the answers, we'll help you find places to get them. So without further ado, I want to introduce Dr. Nikta Fergani. She's going to start with her presentation and hopefully answer some of your questions. Go ahead.
Okay. So can everyone see the presentation? Am I sharing? Okay, yeah. Wonderful. Okay, great. So good evening. It's my pleasure to be here with you tonight. I'm here as a pediatric endocrinologist, but I'm also here as the mother of 2 elementary school children in the public school system in Orange County. And I, like probably most, if not all of you, found myself in the twilight zone in mid-March. And all of a sudden thrown into a world of homeschooling and virtual education. And even though I actually think our schools and our teachers did the best that they could given the circumstances, very quickly realized the limitations of virtual education for my family. Obviously school is not just for schoolwork, it's also for friendships and socialization and exercise and fresh air. And I can go on, and I'm sure many of you have a laundry list of issues that, you challenges that you faced. And that's the reason why the American Academy of Pediatrics earlier on in the summer came out with a relatively forceful statement advocating for school reopening. And unfortunately, because cases in the United States rose significantly over the summer, they had to walk that statement back as the summer wore on to say, well, it's conditional, and those conditions are based on if community spread is low and if schools are prepared. That would be, of course, the reasons why we would advocate for school reopening under those circumstances. And we who live in Orange County are certainly abreast of that conversation, and that's the reason why, because cases increased in such a significant way over the summer, that's the reason why we find ourselves going back, most of us, to virtual education. Either we just started this week or will be starting soon. And so I'm so grateful that Padre gave us this opportunity to talk to you about this now, before the schools actually open, so that we can hopefully give you some data and some information, so you can feel prepared when and if the schools actually open. As Mary said, this is not meant to be directive. We're not going to tell you what the right thing is to do. There will likely be many different iterations, and we just want to leave you with information and data, and as we say in medicine, pearls, little tidbits of information that are going to help you make that decision. So just to start talking about some of the numbers, and I'm sorry, some of these slides are really busy. As of a few days ago, total cases in the United States for pediatrics is about 400,000. That represents about 9% of the total cases. For some perspective, children make up about 22% of the population. So one thing that's unusual or unique about this virus, and we'll talk about a number of things that are unique, but this one is very fortuitous, is that it seems to affect children in a much lower rate than it does adults, and I'm sure many of you have already heard that. And in Orange County, that certainly has been the case as well. The most current numbers, we have about 3,000 cases, and that represents about 7% of the total cases in Orange County. Now, again, unfortunately, as I mentioned, cases over the summer were on the rise. Nationally, there was about a 90% increase in pediatric cases in the United States, and in Orange County, the numbers basically doubled over the summer. But the numbers are falling. So again, as mentioned, the children seem to not be getting the infection as frequently, or at least are not as symptomatic, and therefore they're not really getting tested. Their disease state seems to be very mild, and they also, especially the younger children, don't seem to be transmitting it as much. I don't want you to focus too much on the numbers, because they're actually not accurate. I try desperately to find the latest and greatest numbers, but these are from a few weeks ago. The point I was trying to make with the numbers is, yes, the younger children really do seem to have lower rates overall, but if you look at the teens, especially the later teens, their numbers are in a significant way. So again, even though children in general under the age of 17 are not being affected as much by the virus, or not as symptomatic, they certainly don't get as sick, but the teenagers seem to be transmitting the virus just like adults do. So what about kids with type 1 diabetes? I'm sure many of you felt very panicked early on when you would hear reports that, diabetes and autoimmune disease are, risk factors for severe COVID-19 infection. And hopefully by now you've talked to your medical provider and have learned that they were not talking about type 1 diabetes. They're talking about adults with type 2 diabetes and people with other types of autoimmune conditions. We do not consider patients with type 1 diabetes to be expressly immunocompromised. Yes, they have an autoimmune condition, but their immune systems work in a completely normal way. Now, of course, it's important for your immune system to have, blood sugars as much as in control and in range as possible. The immune system likes that. It keeps the tissues healthy. And so, one of the take-home points and pearls that I want to leave with you tonight is that now more than ever, it's really important to help your children get into as good control as they can. One of the things that I see in clinic, almost every clinic that I have, is how difficult it has been because of the complete life change and loss of schedule and routine. Diabetes definitely lends itself to routine when you're, waking up at the same time and eating at the same times, and that has been completely thrown out the window for almost every single family, including mine. So, now that school is opening, I really encourage you to try to get your kids back on some type of a schedule, get them back into a routine, and that being a conduit to trying to get their diabetes under the best control that you can under these circumstances. So again, kids with type 1 diabetes, not at higher risk of developing COVID. But of course, unless you're a new family, you've likely endured some type of a viral illness with your child thus far with type 1, and you know that life just gets a lot more complicated when they're sick. And so what I've told my own families that I see in clinic, it's not necessary to be hysterical about COVID-19, but definitely important to be careful. So there's still so much to know about COVID-19. There's so many nuances that we're still learning. And in the context of patients with type 1 diabetes, we're starting to collect data of patients that just happen to, either be hospitalized, sick with COVID-19, or even just turn positive. So CHOC is participating in this kind of a consortium of medical centers bringing data together to just describe, what people's experience has been thus far. And in this published report that was just published a few weeks ago, these were all comers, so they weren't just children. There were some adults in this as well. 60% of them were just positive. They weren't particularly ill. They stayed home. They didn't need any hospital care. But 40% of them were hospitalized, and about 20% of them went to the ICU. And we'll talk a second about why. And many of the symptoms that you see on this slide, you're probably very familiar with if you're kind of abreast of the symptoms that people have with COVID-19: fever, dry cough, nausea, vomiting. Loss of smell and taste is less common in children, but those are the common symptoms. And of course, the nuance with type 1 diabetes is that about 50% of the patients had very elevated blood sugars. And that's another unique thing about this virus, is that it seems to drive the blood sugars up in a significant way, even if patients didn't have diabetes to begin with. So the majority of patients that went to the ICU were in DKA. And so again, another kind of take-home point for tonight is, as the winter starts, this year more than ever, you really want to have a sick day management plan in place before your child gets sick. So, again, what do you do on sick days? You check. If your child is on some type of a continuous glucose monitor, you're watching that thing all day long. If not, you're checking your blood sugars at least every 2 hours. You're aggressive about your insulin management if the blood sugars are high. You never omit insulin, right? You always give insulin, even if your child is sick. Doses may need to be adjusted when they're sick, but you never not give it. You want to make sure you're keeping up with the child's hydration. So even if they're not eating, if they're drinking, they're going to prevent them from getting dehydrated. So if the blood sugars are elevated, I'm sure you've heard us say this 1,000 times, if your blood sugars are elevated and they stay high, even though you've given insulin, if your child is not eating or drinking and you're worried that they're getting dehydrated, and particularly if they are nauseated or vomiting, please check for ketones. And if they are high, please contact your medical provider. Much better to get, on top of DKA sooner rather than later. Because again, the take home point from what happened with these patients is that the biggest complication after they got COVID-19 was related to their diabetes rather than to the COVID. Severe hypoglycemia was seen, but in a minority of cases, and then just other associated findings. Average A1C was about 8%, and other major risk factor that they have seen in adults with COVID-19, obesity was also a major risk factor. So moving on to a little bit of the school discussion, let's talk a little bit about where kids have been getting the virus up until now. And I'm not going to go through all of this, all these studies, but the bottom line is, most kids who are getting COVID-19 up until now have been getting it from their households and the adults in their life. And so again, another take-home point is that we need to continue to live in a way that is healthy for all of the members of the household, and because how we live in our own homes are likely going to dictate the biggest risk to our children, and also dictate whether the schools open and can stay open if community transmission rates stay low. So are kids getting the virus at school and camps? Well, I made this slide maybe about a week ago, and it's already outdated because I think literally every day I feel like there's a new report of a new school or a new place or a new university that's shutting down because of an outbreak. And if behind, beyond the headlines, the truth is that there are schools that have been successful around the world and even around the country. And so the data is actually variable, and it really likely depends on community prevalence and home behaviors, which we've already talked about, and safety measures at school, which we're going to talk about next. I'm sure many of you have heard about this notorious camp in Georgia, where essentially they shut down and 50% of the kids that were in the camp were infected with COVID-19. And when you, it was an overnight camp, and when you go into the nitty gritty of what happened in the camp, it was literally a recipe of what not to do. Like everything they weren't supposed to do, that's what they did. So, community rates were high in Georgia at the time. There was no shelter in place. They didn't physically distance the kids. They weren't wearing masks. They were, sleeping 26 in a cabin. There was no ventilation in the cabins. They didn't cohort the kids. You're going to hear me talk about this. I think this is a very important piece of this, is keeping kids together in small groups. I'm not talking about 26. I'm talking about like 4 or 5. So if one person is sick, you're only affecting your little group, your only pod, and it's not spreading like wildfire, which is what happened here. And it happened to rain this week at the camp, and so they were not outside the entire time. They were indoors doing what kids do at camp, which is yell and scream and sing and act cuckoo the entire time. And so it was just a perfect storm. There are examples of places that have done this successfully. There was a camp, it was an indoor camp in San Francisco, and none of the kids were sick at the beginning or at the end of the camp, and they basically did the diametric opposite of what the Georgia camp was doing. So important to know that there is a way back. One last thing when we're talking about, the age of the children, we talked about how teenagers, even though they're not getting as sick, they're still transmitting the virus in a much more effective way. And this French data really illustrates that. These were schools that were open when community rates were high. They were actually not masking at the time. That's not really a technique that has been used extensively in the school system in France. And what they found is the elementary school kids had about a 9%, when they checked the antibodies a couple months later, the 9% activity rate, which was just kind of reflective of what was going on in the community, right? The high schoolers had 40% positive antibodies, reflective of the fact that they were likely transmitting to each other. So the age of your child is something that you should take into consideration when you're thinking about school or how the schools, should open. So I'm going to talk about factors that I think from a medical perspective we should think about. Do all the schools have to do every single one of these things? No. Many schools are still being successful and not doing all of them, but most of the schools that have been successful around the world are doing much of this. And so we're going to talk about what I think are really, things to think about. We need to screen. Does that mean getting a temperature check every day when the kids enter the school? I'm not sure that's exactly the answer, but there needs to be some type of a screening process for the kids to come back to school. A questionnaire of some sort, some accountability. This is not the year to Tylenol your child up and send them to school. And I'm not being judgy. I totally understand why that happens, but this is not the year for that. If your kids are sick, they need to stay at home. The kids need to be distanced. And this is really about class size. You can't have 30 kids in a class. They need to cohort. If they cannot, if the school is not able to keep the kids apart because of, budgeting and space and the rest of that, they need to cohort the kids. So only 5 are together in a group. So again, if one gets positive, then they're only affecting that 5, and it's not completely disruptive and shuts the entire school down. A lot of the European countries are thinking about open air. I mean, we literally live in one of the most beautiful places on the planet. We need to think about being creative. They're holding school outside. If you're inside, you need to ventilate. You need to open the windows. You need to think about scenarios where the virus may transmit further than 6 feet. So when people are singing and yelling, that's actually when the virus appears to get airborne. and gets further. These kind of super spreader events that you've heard about in places where people are singing, that's why that happens, where like 80% of the people get sick. That's why that happens. So if there's something really exciting happening, in the classroom, just take it outside. That will be a much safer option than keeping it, in the classroom. And then we need to think about, protection. I really considered not talking about masks tonight because I know it's such a controversial issue. And, I'm hopefully, I'm not putting my entire, foot in the flame, maybe just like my pinky toe. But I would be bereft medically to not talk about the utility of masks, even though I think that I understand that they're irritating and they're difficult, and it will be very challenging to keep kids in masks, and there's definitely kids who can't wear masks, but the medical data advocating that masks are an effective way to prevent transmission of the virus, that data is actually not controversial. And so, we just need to think about how we're going to do it. The main purpose of wearing a mask is actually completely altruistic. One of the worst parts of this virus is that people are the most contagious before they're symptomatic. And so the whole purpose of really wearing the mask is to protect other people before you're actually symptomatic and can spread the virus around. There is some protection conferred that if you're kind of covering your nose and your mouth, which is how the virus gets into your body, that seems to confer something. And I think for children, the point is for them not to be, what they're doing all day long, the finger in the nose and, in the mouth all the time, just to protect them from putting their fingers in their mouth and their nose. And actually, there's actually some really interesting data that, how much virus you seem to be exposed to. So even if you get sick and someone transmits the virus to you, how much virus you actually got exposed to seems to make a difference in terms of how sick you become. So if you have some protection that you only get a little bit of the virus, that actually seems to make your disease less severe. So for all of these reasons, this is the reason why the CDC has been advocating for mask use over the age of 2. And, the rest of the things on the slide, you can read. I'm sure many of you have heard about things, we need to hand sanitize, there needs to be soap in the bathroom. All of those things really need to be in place. And even though it may be challenging to get some of these things done all the time correctly, the way I think about it is, if my child's kindergarten teacher can keep the kids in their seats and, hands to themselves, sitting down and listen to her reading a book for a half an hour, we can do this. These types of habits can be taught and reinforced in this, wild year that we are in, and hopefully, will be a distant memory as time goes on. And so, the bottom line is people are doing this. There are places around the country and around the world that are opening. And, and how are they doing it? Well, the first things first, community spread and rate is much lower. And that's the predicament that we find ourselves in. And the good news is that the rates in Orange County seem to be dropping precipitously. So we may find ourselves in the situation where schools are going to open soon. You can see, some of these are examples around the world. In Asia, there's a lot of, there's no stigma about wearing mask use. They unfortunately have endured a number of epidemics over the last, 2 decades. And so they're, for them, it's like not socially abnormal to wear a mask if you're sick. So for them, you can see actually the kids are not distanced from each other. Their school rates are very low still, but they use shields and masks. In European countries, they're usually using a lot of the spacing. This is obviously kids in an auditorium. They're not in a regular classroom, and the kids are spaced out. Again, this is this open air concept where the kids are outside. This is how other places in the world are doing it and keeping their schools open and not having to immediately shut down because of outbreak after outbreak. And then testing. This is the other thing that other countries have, and it's something that we need to strive for, is rapid testing. So if one child gets sick, if you can know within a 24-hour period of time if that child is positive or not, then that will be way less disruptive than if you can't if you can't test, or you're not going to get a result, for 7 to 10 days, it completely defeats the entire purpose. The schools really need to have a plan in place. If someone gets sick at school, if they have a fever, where are they going to put those kids? Do the other kids need to isolate? And again, how are we going to test? So those are things that most districts have actually thought about. There are plans. Those should be things that you would think about as well. And last, I added this, even though I know I am limited in time. History really does repeat itself, and hopefully we're learning and listening. The same issues and controversies that we have had about mask use and community shutdown in schools, they were having them 100 years ago. There's been well documented. They were having it during the last pandemic in the United States, and this is this really charming picture of kids outside at school 100 years ago. They were thinking about the same things. So, the other things to consider is the village that takes care of your children, right? I definitely have a village that takes care of mine. You want to think about who else lives in your home, who else takes care of your children and is exposed to your children. Again, especially when you're thinking about the teens that can be transmitting, you really want to take, are there people in your lives that have all of these really high risk things, that have been reported, that would put them at risk. And then just a moment on legal protections. I know Allison is going to go over this in much more detail, but just from a medical perspective, I want you to think about this year like you would any other year. Have everything prepared just like you would, even if you have decided that you're not going back to school and you're going back virtually. Still, it's important to have all of this paperwork in place so that, if things open up quickly, if you make a different decision, that all the ducks are in a row. And from a 504 plan or IEP perspective, we encourage you to continue having those plans in place if your children have needed accommodations in the past. All the little issues that come up, or big issues that can come up, can happen this year as well. Your child can wait, if they're on a pump, they can have a site failure when they wake up in the morning and maybe can't, attend a test or a Zoom meeting or whatnot. And so this, whether it's virtual or in person, those issues can arise. So we really encourage you to, kind of keep those protections in place. And lastly, I'm going to just leave you with a little nugget of hope. I think one of the things that has been so challenging about this year has been, all the change that people have endured, overnight, life changed for us in a moment. I think, the first slide has a caterpillar saying, "You've changed." And the butterfly says, "Well, we're supposed to." And that has been, a source of a lot of anxiety for a lot of families because change happens so quickly. So what is helpful for me is to think about things that I can do to control in a completely uncontrollable situation. And so I really encourage you to continue physically distancing. That doesn't mean social distancing. I know there's been so much anxiety and depression, especially in the teens, because they've been far away from their friends. So that doesn't mean not connecting to other people, but just standing slightly far away from them and maybe outside. The less there is community spread, the more likely the schools can open and the less likely we're going to have to shut down and make it even more disruptive because there are outbreaks. All the things we talked about, kind of common sense things to kind of protect yourselves, help your children get into good glycemic control, contact us. This is our job, to help you if you need it. And just a plea from our infectious disease division, please get your flu vaccine this year. We obviously advocate it every year. That's advocated by the ADA. It definitely doesn't protect you against COVID-19, but it makes you less likely to get sick over the winter, keep you out of urgent cares and emergency rooms, and keep your immune system healthy and less susceptible to other viruses. So with that, thank you so much for your attention, and I think I will hand it off to Allison.
Okay. All right, great, thanks. So we're moving forward. We're just going to pretend. We're just going to assume that school's starting, and we are going to. Since June, actually, we've been handing out school forms in the clinic, and we will continue to do that. Every student, as you guys probably already know, needs a new diabetes care plan for the year. And we've actually changed them up a little bit this year. They're a little bit more detailed. They're 3 pages long. We've included a section on there for a checkbox where we can allow people to use, kids to use their Dexcom readings instead of actually having to do a finger stick, as long as the blood sugars are between 70 and 300. That'll alleviate some of the sticks. We've also added to the form Baqsimi, which is a nasal form of glucagon. Once the schools find out about that, they may be anxious to actually have that replace the glucagon, because it's a simpler way to give it, and it's a simpler way for them to teach the glucagon. But just they actually, it's insurance. If the insurance covers it, that's how you're able to get it. So they can't demand that you actually have it at school, but it is an option. What else can I say? The school nurses, it's in public schools, it is not your responsibility to train anybody on the care of your kids for their diabetes. They are well educated. We take the group of school nurses every year through Padre Foundation and educate them on the basics of diabetes, including pump and sensor therapy. So it's not your responsibility to train them. It's the nurse's responsibility to train the health clerk or whoever it is that's managing or supervising the diabetes care in the school. Okay. I don't know if there's anything else that I can touch on. I'd be happy to answer questions, but just a reminder that everybody needs a new form every single year. Okay.
So we are being asked if we can get this presentation. Yes, is that Dr. Fergani? Is that okay? Okay. Yes, and we are recording this so that you'll be able to listen to it again, because there is a lot of good information being given to you. But we really encourage you, when you have your endo appointments, ask for the forms. If you want to do the 504, let's get working on it now. It needs to be simple, short, sweet, and to the point, but let's get it together, because we don't know what's going to happen in September 9th. Some start at the end of August, and you could be 2 weeks in, and then all of a sudden you got to go to school. So what kind of questions do you guys have? Is there anything that you want them to address? You have these 3 specialists here that you don't usually get this FaceTime. So any good questions out there? I see some new families. Anybody? We're here to listen.
I have a question.
Gary?
So if our child does get symptoms of COVID, is there guidance for us? Like, do we immediately contact the endocrinologist? Or I saw like the care steps and things like that, but is there anything like additional that we should do to be proactive at that point?
So I think, you really want to think about this as any other viral infection, plus, right? When, you would do your sick day management the way you would under normal circumstances. The types of, kind of catastrophic things that people are hearing about adults, like a very, quick decompensation that happens a week after infection has not been seen really in children. So those types of things that you maybe have heard about that you would need to worry about, we really haven't seen in pediatrics. Obviously, you want to keep an eye on, respiratory symptoms if they're having them. If your child were to actually test positive, please do reach out to us. We're interested. We'll obviously, take care, help you take care of things. CHOC also has a hotline that is a COVID-19 hotline. I think it's 1-844-GET-CHOC. I don't want to say that incorrectly. It's on the CHOC website, and it's a COVID-19 hotline, and it has been active essentially since March. And so, if there are specific questions about testing or symptoms your child is having not related to their diabetes, obviously reach out to your pediatrician, but that resource is available at CHOC as well. But from a diabetes perspective, you just want to treat it like any other viral infection, but just stay on top of it, because again, these patients that ended up, coming to medical attention with type 1 diabetes, had a relatively high rate of going into DKA.
Thank you.
Shannon, did you have a question?
Yeah. So my question is more from like a teen perspective, with the wide variety of teen behaviors in my kid's friend group. Is it necessary to keep him away from teens who are more active out of the bubble, or just keep him in a mask?
I think the short answer is, and this is literally what I've been telling all of my families, and believe me, I have little children, we have our own challenges. I think the teens are actually the most challenging group, to kind of, deal with this crisis. What I've been telling my own families is, yes, they should be wearing a mask. It's all about risk. It's risk stratification. They should be wearing a mask, and ideally should not be going into other people's homes, and should be, staying outside. The higher risk would be not to wear a mask, obviously, to be closer and to go into other people's homes and touch surfaces in other people's homes, and then somehow, get that on your face, in your nose, and in your mouth. So the answer is, I really do think that there is a way for the teenagers to socialize, but they just, they got to follow rules. And if not, I'm sure, again, you've heard all over Orange County, there's all sorts of events of birthday parties and events like this that lead to, 50% of the kids, doing okay, but getting infected. And I think the only little asterisk I will say about, yes, the kids have really mild infections, is this virus is so unusual in so many different ways. We just don't really know what, the long term is. And so, I'll be honest and tell you, there was a time early on where a lot of us in medicine thought, well, if we just get it, we're kind of healthy, then we'll kind of just weather the storm and be okay. But as time has gone on, many of us have said, no, I don't know how this is going to go for me. I'm going to try to avoid the infection. And that's how I think we should all live. When I interact with people, the way I think about it is, I behave like I'm infected, and I behave like they're infected. And that's how we have to live. But that doesn't mean we never see each other again. We just have to live in a different way than we were living before, for now.
Okay, and kind of as an add-on to that, how about like eating? If you eat outside and distanced away from each other, are you okay to like eat with people not in the bubble? I haven't done it yet, but I've been wondering.
I mean, I think if you are outside and you're eating your own food and you're like far apart, I think risk is low. I mean, I just think in general, outside, the risk is low. This is not airborne like tuberculosis where, someone's like 15 feet away from you and, the spores are, traveling around in the air and, get to the other person. It doesn't behave like that. So if you're out in the open, the risk really decreases significantly.
Right. Because I'm wondering, would schools go back like with lunch and things like that? And if they aren't willing to do, I guess my biggest fear as a parent is if they turn around and say, okay, next week we're starting hybrid, and we're looking at the numbers and nothing has changed, which I think is a somewhat likely scenario. I'm just not sure whether that's a safe situation to send them back. Yeah,
and I think, that's, That's the challenge. That's the crux of the issue, right? And I think every family likely has their own issues to deal with, right? Can you make sure that your child is going to follow the rules? Is that kind of, how your child goes? And, and keep in mind, kids behave differently at school than they do at home, right? If everybody else is doing it, that's much more likely that they're going to follow the rules versus like maybe what they're doing, if they're left to their own devices. So I think school situation can be distinct in that way. But I have to say, California has been relatively stringent. And, Orange County, I think the only thing that is left is that our case rates like per 100,000 are still very high. That's the only thing that is keeping us on the watch list at this very moment in time. Because really, on a very positive note, cases are, if we can trust the numbers, the cases look like they are precipitously dropping. So once we get past a particular point, we should feel better about school reopening. I don't know, Mark, if you have other thoughts. I know you've been quiet.
I said I was just going to sit here and wave and smile. That's what I said. So I'm following my guidelines. No, I obviously have a lot of thoughts. Nikta and I have, Dr. Fagani and I have chatted about this tons, Alice and myself. What I'm really going to say is what Nikta sort of started off with is there's change, and not just change in what we have to do, but changing the information we're getting, right? So very early on, you might recall, we all were saying, well, I don't think we need to wear masks. And, that was one of the things that we were hearing as more information came in, as data came in, as knowledge and input came in on this very understudied and now maybe, better studied virus. We learned that masks actually do seem to help. Number two, I'm going to say anything we say today, and I think people already seen multiple people ask for the slides. Anything we say today, we may change tomorrow. So get ready for that. And that's not because we're not assessing the data as we have it. It's just the data may change. I am heartened by the fact that numbers seem to be going down. I honestly believe that's because we're doing things. It's I believe that there has been a shift in how people are going about their day-to-day activities. I sit here in a very fortunate position with both of my kids out of the grammar and high school ages, and feel very lucky to say that, I don't have to, try to corral a 5 and a 7-year-old in front of a computer screen. The irony of it all is for years we've been saying, limit screen time, limit screen time, limit screen time. And I was saying, you have to sit in front of the screen, and that's really been frustrating. I do want to say, again, I'm going to say a majority of our kids that we know of now, if they get sick, they actually recover quite nicely. I'm going to echo what Dr. Fagani has said, which is, like any virus, we have to be on top of it. If they get sick, we're going to be watching their numbers. We're going to be checking for ketones. I see some of my families online right now, and I would go through my little, if you ever get sick, if you throw up, what do you check? When do you, blah, 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 my whole thing that I go through, because I do believe that that's the one thing we really, when we're seeing our kids get sick with any virus, and including this one, we want to make sure they don't get ketoacidosis. That's going to be my number one. I do, as I tell people a lot, clearly my crystal ball is broken, because anything I've ever predicted, I can't say it's come, my predictions are not always coming true. And the quick and dirty on this one is, right now I'm saying I think our kids are going to recover quite nicely, but some of them may have some long-term issues. So I hope not. I don't think so, but I'm going to keep my options open that that's the case. And the only other thing I'm going to say, and then I'm going to just go back to smiling and waving, is that, I see all the faces on here. I know a lot of the faces, and it's so fun to see. But what I'm going to say is every family is different. I don't think every family quite appreciates that. But as we go through our day as physicians, as diabetes educators, as community workers, as parents, when we're walking into every room, we know that we have a different family, that we have different priorities to address. And so what I may actually tell one family might be slightly different than another family. It's not that my advice is changing. It's, we have to look at each family's priorities, what they have access to. I actually am going to say one of the biggest questions I ask when someone says, should my child go back to school? The first one is I always say, well, what do you think? The second thing I say is, well, who's at home that's at risk, right? Who is your cohort? Who's your village, as Dr. Pagani said? Who are the people that are taking care of your child? And if your child gets sick, they probably are going to get better. But what if they get somebody you love sick at home? And how do we handle that? So that's one of the big questions I ask. There's about 6 or 7 other ones. And at the very end, I always go, I don't know. Let's wait and see. So I know it's really frustrating, but I want you to know that we are trying to tailor this to every family, that we're not just giving a cookie cutter, yes, no, you should, you shouldn't. Because there are very different situations for every family that we know. And I don't know 2 that have the same. So that was just my big overarching comment. I really, I've said this to a lot of people, so it's not something unique. I think Dr. Fergani said, please don't panic about this. And I really want people to hear that this is not that same thing when you watch TV and diabetes is a risk factor for complications and intubation. And that's just not what we're seeing in kids. Could that change? Yes. But right now that's not what we're seeing in kids. But we do recognize that they are getting sick. 2 months ago, I keep telling people, I could tell people that there were no kids in our hospital with coronavirus, and I cannot say that anymore. We recognize that it is hitting our kids. Some of them are getting sick. Fortunately, it seems like it's not affecting our kids with diabetes more dramatically than the general population, but there just aren't enough numbers to actually say that with 100% certainty. So, okay.
Thank you. I do have a question, or one thing to actually consider with your children. If you decide to keep them home, does that also include, a lot of these kids are finding ways to have join sports, still do their activity, even though it's not supposed to go on. But that is a question to ask your friends. Is your child playing soccer, going to soccer practice or anything like that, but yet they don't want to send them to school? So in your consideration, think about that and what families are actually doing, and that they're being honest about it and telling you, because that means more exposure for your friend's child, your child's friend going out and bringing it back to you. So these are just all things to consider when you're trying to decide what to do. Anybody have any questions or comments or pertains to our family?
Yeah, I have a question. I feel like pretty early on with when we heard about coronavirus, we were hearing a lot about respiratory problems and complications for those who have asthma. So our son with type 1, Evan, he does have asthma, but I feel like I'm hearing a little bit less nowadays about that being a higher risk factor. Has that changed at all?
I'm not completely up to date on the asthma data, but I have heard other physicians who are, more on top of that data say that asthma well-controlled asthma does not seem to be a risk factor for a severe infection in pediatrics. We are not seeing that in the hospital. So again, is asthma in general and for the general, overall respiratory issues in general? Yes. But in children that have well-controlled asthma, that does not seem to be a risk factor.
That's a good question. Anybody else?
Just to make a comment, I think someone before the presentation had asked, like, you know, what are the greatest risk factors to children? And, you know, what has been reported nationally and internationally, and also we have experienced at our hospital, frankly, the greatest risk factor is obesity. So the children that we have seen at Chalk that have been the most ill have shared that as a risk factor. So other than that, I don't think there's anything specific. You know, of course, premature, children, with underlying, lung disease, cardiac disease. Sorry, our clinic shuts down at some point. We conserve energy here, Chuck. So things like that have been seen, of course, but obesity has been pretty consistently found nationally and internationally. And again, obviously, type 2 diabetes as well.
Okay. All right. We're in.
We have.
I was just, I was unable to unmute. I'm going to just echo again what Dr. Fergani says, just because it makes me sound smart when I say what she says. So the second part about that is, obesity is one of the challenges. That's just a challenge across the board, but there's something about how that impacts how the virus sort of gets to the different parts of the body. And sort of causes inflammation. But the second thing there was from that data set that Dr. Fergani had talked about that we're part of, there is some indication that the ones who are more likely to be hospitalized were the ones with higher A1Cs. I think Dr. Fergani touched on that and said, please make sure that everyone is doing the best they can. What I want to say is again, the families I'm seeing here now, I don't see that as a concern. We're not talking about the difference between 6.3 and 6.7 or 7.1 and 7.8. The breakpoint seemed to be something above 8.5 or 9, started putting people at a slightly higher risk for getting hospitalized. So those are the numbers we're looking at. I really don't want this to make people who are right now at and we don't want to over focus on A1Cs, but people who are, at a 6.8 or 7.2 to try to get it down to 5.9. That's not going to make the difference. The difference really is that higher level of A1C. Again, I think Dr. Fergani mentioned this viral load. So we do think that those who are exposed in a much closer, much more intense situation are going to have more major impact on them. And that's just across the board. That's not just about diabetes or not diabetes. And the whole mask thing, again, without getting, I realize I try not to talk politics in the office, but now I can't even talk about a mask without feeling a little bit weird. But the mask, like we heard, serves many purposes. Number one, and 1, 2, and 3 is it really makes sure that you don't give it to somebody else. And as I've told everybody, I can't imagine what it would feel like if I knowingly and carelessly gave someone I care about, and by the way, I care about all the kids I see, but if I gave someone I care about an infection that I could have prevented, that would be the end for me. I mean, you'd have to talk me off the ledge. Number 2, so wearing that mask really is to make sure other people don't get sick, and I think that we really should think about that in that way. Number 2, as Dr. Fergani said, it really kind of prevents you from poking at your nose and your eyes and such, and it kind of is a nice reminder. If anybody seen me in the last couple weeks, we at Chalk have been sort of now guided to wear shields or eye guards when we are getting close to families. Fog up, can't see, but again, that actually is to protect us. So if somebody takes a deep, we're always saying, take a deep breath. Well, they pop it in our eyes and now we're sick. And we can give it to the next family. We don't want it, not the next family, but 3 days later, 4 days later, them. We don't want to do that. So we're wearing our goggles. Now we're not asking everybody to walk around wearing goggles, but if you are going to be in close proximity to people, that's not a bad idea. And again, it also kind of reminds people not to be poking at their eyes. So there are some things we're doing. I actually think we've heard from many people that chalk is actually on the front lines of really trying to be protective, not only for the staff, but for the patients. Yeah, Mary, now you have to move. By the way, I can't tell you how many times those lights have gone out on me too, Nika. So that's our Newport Beach office. So anyway, you know, we're really trying to be good stewards. We really are following guidelines and actually going above and beyond at Chalk. You may actually, there's something I've heard that may actually say otherwise, but we really are on the front line of being very protective for our families and our staff. So the long story short, I don't know that, you know, I have many people ask me, should my child go back to school? And I've already said this tonight, which is look at your family, ask the same questions, ask what about your child? I sometimes say, what would you do for your other children? And because at some level, we want to make sure that we're not isolating and making our kids with diabetes feel like they're, you know, overly fragile. But we do have to, you know, every family is going to have a different view on this. So that's my big editorial on this. And the lights aren't going out on me. Maybe they should.
There's a question about hospitalization numbers, kind of a question about, you know, how high they are at Chalk. We definitely have had kids hospitalized at Chalk, but I really want to reassure you that the hospital is doing a gargantuan effort and actually has been kind of a leader in this, at least in Orange County, in keeping the hospital environment safe. We are not authentically seeing outbreaks even within, you know, hospital staff. I'm sure many of you have maybe heard that, you know, places around the country where, you know, caregivers are passing it from person to person to person, and we have not seen that, frankly, at all at Chalk. So we want to reassure you that the hospital is safe. If you want to get lab work done, you know, if, you know, your child is sick and you need to bring them to the hospital, frankly, if you have a clinic appointment, and especially if you know, we are encouraging you to come into clinic to be seen, please feel safe coming to the hospital. We have up until now, we have not seen kind of what we call, you know, nosocomial spread, meaning, you know, people in the hospital spreading it, you know, to each other. So I really want to reassure you about that. One of the things that many people have worried about, and I continue to worry about, is people not coming to medical attention when they are sick because they are afraid to come to the hospital. And, you know, we have already ourselves at Chalk experienced a couple catastrophes because of that. So, you know, you hear it from me tonight, spread it around to your friends who get their medical care at Chalk. You know, feel secure bringing your child to the hospital for care. You will see us complying. We screen every human that comes through the door, you know, babies, adults, you know, everybody, including us, on a daily basis. We are using masks and shields. If there is a COVID-19 patient, I cannot, frankly, begin to describe the gargantuan effort it takes to go in and out of those rooms. And we are extremely diligent about how we take care of those patients so that we aren't bringing the virus out with us, and frankly, protecting ourselves and you and we are seeing. So again, the hospital really is safe. It's safe to get blood draws, safe to come to the clinic. And please, if your child is ill and you think your child needs medical attention, don't hesitate to come to the hospital. Bring your child. If you call us and your child is in DKA for some reason, or is severely hypoglycemic and you can't take care of it at home, and we say to you, please come to the emergency room, come.
Real quickly, I want to just clarify, and I think I'm going to ask Dr. Fagani to clarify a little bit for me, because I've gone through these numbers and now they're getting jumbled in my own head. But the number where you said 30% of hospitalizations were DKA, I want to clarify and say that 30% of people who are infected with diabetes aren't coming in DKA. It's that if someone ends up in the hospital, it's 30% of the time it's because of DKA. Is that a correct statement?
No, 30% of the patients that were type 1 diabetics, and I didn't put this little nuance in there because it was just too much to go over. But not all of these patients were actually COVID-19 positive. Some of them were presumed COVID-19 positive, and I'm sure you've heard about this. There's like a problem with tests, but frankly, if you can't smell or taste, and you're having severe shortness of breath, and it's today, we're going to think you're COVID-19 positive, even if your test happens to be negative. So they were all comers. 30% of them were in DKA.
Okay, real quickly, that was even adults.
Correct.
That was
correct.
Yeah.
These are all comers. They ranged between 5 to 34 years of age. The average age was 20. So yes, it doesn't mean that 30% of kids, coming in would be coming in DKA. For sure, that's absolutely true.
All right.
Can I just ask a quick question regarding, for my son is just turned 18, and I should still go to chalk, right?
Yeah.
Okay. Thank you. That's what I wanted to hear. Thank you.
Okay, on that note, Stephanie, I did ask that question. My daughter's 19, and I said, if something happens and she needs to go to the hospital, can she go there as a 19-year-old? Because, you go to Hoag or any of the other hospitals, I'm not going to be able to go in with her. But she is still a patient at Chalk. She is still under their care. So yes, it's a very good question. And that's the kind of stuff that you need to be prepared about and have a discussion with your child, because if something happens to your child and they're not with you, they need to know what they can do too.
Right.
That's being prepared. Yes.
My son just knows to yell for Dr. Daniels.
Okay.
Wait, he did what?
He just knows to yell for Dr. Daniels.
All right.
Yeah, I mean, again, just the last note is, the patients that, did end up needing hospitalization who were type 1 diabetics mostly had issues related to their diabetes. And so you kind of really want to go to a place that is familiar with your child's diabetes and knows how to take care of children with diabetes. And yes, the time has passed that we think of, 19-year-olds as adults. They're children. So, there was a day where that wasn't, but that's not today. 20s, the 20s, they're still kids. So yeah, no, those, you want to bring them to a place that's going to be able to take care of your children.
Shauna?
Yeah, I just wanted to, one just last quick question, and thank you, Dr. Daniels and Dr. Fergani and Allison. This is such great information. Is the flu, I've heard the flu vaccine is available. Is that true? Because it seems early, so I just wanted to check.
I have also heard that the flu vaccine is available, and it is early, and I think on purpose it's early this year. We do not have it yet at Chalk. Mark, correct me if I am wrong. The only thing I told a family that recently told me this is I just said, please make sure you look at the bottle and make sure it says 2020-21. And it's not last year's flu vaccine that they're giving you. Because yes, it is early, but around this time, late August, early September is usually when the flu vaccine becomes available. So yes, it is early this year. And, usually the Southern Hemisphere gives us a little bit of information about how the flu season is going to go. And it has been actually more mild. I don't want to, say anything that's not true. As Mark said, things change every single day. But that probably is somewhat reflective because, people are doing all this stuff for COVID-19, and that will make the flu season, if you're complying with it, it's going to make the flu season much more mild.
Thank God.
Yeah.
Yeah. And so I'm gonna, I used to be, 15 years ago, that tough guy who said, I don't need a flu vaccine. I'll just tough it out. And I really did. And I still have that sort of internal, I'll just tough it out. But I'm going to go back to my comment that for me and for all of us, if we get the flu, we could give it to somebody else. And I would never forgive myself if I gave the flu to anybody else, especially with the panel of kids that we see, including cancer kids, including kids with true immunodeficiencies. It would be miserable. Number two, I think what Dr. Fergani said is, more than anything, for me, I would love to not have a kid get a fever and have every family immediately assume it was coronavirus. So if we could actually prevent kids from being at risk for thinking someone they have coronavirus, that would be great. So now you don't have to wonder, oh my gosh, does my child have COVID, and we have to go get tested for that. So getting the flu vaccine, which is a simple thing to do, it hurts a little, I'll be honest, but it's a simple thing to do, is really important. Number three on that one, we have been frustrated for years that in our Orange office and other offices, it's almost prohibitive to get the flu vaccine from us because we say you can get it, but it might be $160. And if you go to your doctor's office, it'll be $0. And then people, I'll go to my doctor's office. And then 3 months later, they haven't gone. I want to let people know that I and others, I won't say just me, but I and others have been jumping on tables saying, okay, Chalk, if you really believe this to be a really important thing, put your money where your mouth is. And let's give flu vaccines to everybody, regardless of cost, regardless of care. Let's get this done. So I can't promise that that's going to happen, but there's a momentum now. So that's wonderful. And then a reminder, the flu vaccine does not prevent 100% of the flu. People go, oh, I got the flu vaccine, I still got the flu. And that actually does happen. But when you get the flu after getting the flu vaccine, it tends to be milder. So that's good. And number two, it does prevent some from having anything. So sure, it's not perfect, but it definitely is going to be better than not getting the flu vaccine. So I'm going to be that guy who said, I used to be the one who said, I don't care if I get flu. Now I say, come on, let's get the flu vaccine. It really is important.
All right. Well, I think we're about out of time. We're a little over. But I want to thank you, Dr. Fergani, Dr. Daniels, and Allison. You guys, I think it's good information to get out there for all of our attendees. If you could spread the word, let them know. And if any of you have any questions, again, let us know at the office here. Give us a call during the day. Someone's always in the office, and we'll be glad to help you guys.